Should survivors of sexual assault be able to gather their own evidence after the crime? It's a question Maryland lawmakers may soon consider.
This as a warning now coming from the Attorney General's office. Fox 45's Shannon Lilly investigates.
Over 50 years ago, the at-home pregnancy test created a lot of controversy, so we see ourselves in the same light.
It's being touted as an easy, innovative tool.
Most survivors aren't coming forward, and they're having to handle that without the support that they may need.
But inside this little box,
it says here, for survivors, by survivors.
A way for survivors of sexual assault to do the work typically cut out for a trained forensic nurse, collecting DNA instead from the comfort of their own home.
To go immediately to a hospital setting after being assaulted can be intimidating.
Leda Health COO Dr. Sean Bogle stopping by Fox 45 News back in August as he made the rounds, marketing Leda's early evidence kits around the state. His visit preceded by this press release sent to us from a PR agency called Flow Communications on the company's behalf. It claims a new state law rolling out in October would allow for these so-called do-it-yourself kits to be used as evidence and administered by healthcare professionals.
The bill makes it very clear that at-home kits can be acknowledged in a court setting as a piece of a medical record.
But those are misleading claims, according to the very senator sponsoring the bill.
Senator Hettleman with two bills now.
We are not giving our blessing to them. We are at the point where we're considering how and if they should be available in Maryland. I have concerns about how the company is representing itself.
And she's not the first to raise red flags.
Before you is House Bill 1564.
Clear across the country to the opposite coast, a battle playing out in a February Washington House committee hearing.
There is no good reason to make a survivor of sexual assault pay to unknowingly prevent the justice in their case.
We do not sell directly to consumers or victims. We present an additive option.
That additional option, though, brimming with glaring problems, according to Washington state leaders and attorneys.
There are acceptable standards for evidence collection and evidence handling, and these kits do not meet the mark.
Just imagine you take your own rape test kit evidence and then you go take a shower. And then you find out that the evidence that you collected in your room will never make it to trial.
Washington State Representative Gina Mossbrucker forging the bill to ban at-home kits in her state. That bill passing and signed into Washington state law in May, but not without a fight.
But when we got to the Senate, the lobbyist was waiting for every legislator before every meeting out of their office to try to convince them to vote against banning it. I've been a legislator 10 years next year. I've never seen that.
Months prior, this cease and desist letter issued by the Washington Attorney General's office accuses Leda Health of deceptive practices and preying on a vulnerable population. And the more we look, the more we find. Here, cease and desist letters and warnings stacking up in states across the country for Me Too kits. It was the company's original name before rebranding to Leda Health. And that brings us back to Maryland, where Fox 45 News is now uncovering this letter circling from the Maryland Attorney General's office. The office confirming to us the letter was sent in August to hospitals, universities, and other agencies, warning them of multiple and repeated reports that at least one manufacturer has been making false and misleading statements in promotion of their self-administered collection kits. The Attorney General not confirming Leda Health is that manufacturer when we questioned, but claims like the one sent to us in this press release, indicating the kits could be authorized and administered in the state and used as evidence come October 1st, deemed false in the AG's letter.
To in any way apply that this is going to be admissible in court, I think is very misleading.
Baltimore County State's Attorney Scott Schellenberger warned against at-home kits back in 2019. He didn't believe the kits would be a pathway to justice then, and tells me the same is true now. At issue?
We document the chain of custody of exactly when it was taken, who had it, and the next person to touch it.
The lacking chain of custody needed for prosecution, and the inability for a survivor to submit the DNA they've collected into the National Criminal Database called CODIS.
If you're sexually assaulted by somebody you didn't know and you use an at-home kit, that kit and the test you do, even if we get DNA off of it, will not be admissible in the CODIS system. And that means we may never find the person who sexually assaulted you.
Schellenberger serves on the Sexual Assault Evidence Kit Committee. It's a group of police, prosecutors, nurses now tasked with looking into these at-home kits and providing recommendations to the legislature come December as directed by Senate Bill 789. I asked Schellenberger if a ban like that in Washington could be in the cards for Maryland.
That could definitely be a possibility in the legislature.
Do you think it needs to be?
Let's see how this plays out.
Meanwhile, Leda Health maintains it is not a medical care provider and encourages survivors to seek professional care.
Simply looking for DNA. So it's not intended to give a survivor false hope or be a silver bullet.
Shannon Lilly, Fox 45 News.
I'm Kai Jackson. Thank you for watching. Here's another video to watch. Also, please take a moment to subscribe to our channel.